From the start of the pandemic, Public Health England's played a pivotal role, rapidly developing a COVID test and collecting crucial data on cases and deaths. But some say it's been slow and over-centralised, a criticism echoed by the Prime Minister at the end of June.
The parts of government that seem to respond so sluggishly, so that sometimes it seemed like that recurring bad dream when you're telling your feet to run and your feet won't move.
This week, things are moving. Public Health England to be replaced by a new body, the National Institute for Health Protection, incorporating pandemic response work with the Test and Trace programme. But one of the architects of Public Health England says any failings lie firmly with the government.
If there's anything that the Secretary of State, Matt Hancock, wants Public Health England to do by way of working with NHS Test and Trace, by way of working with local authorities, by way of expanding or changing the testing capacity, he should direct them to do that. And simply trying to move around the structural architecture doesn't help anybody at this stage at all.
The new organisation will be modelled on Germany's Koch Institute, which quickly mobilised mass testing.
It is part of the federal government, but it is run independently. So, the science that we produce, we can, say something about it and do so independently. Nevertheless, it is part of the federal government. But, that is, it sounds like there's tension in this, but you can have both.
Public Health England covers more than COVID. Its roles include obesity, smoking, vaccination and heart disease. Many say criticism of its work is unfair scapegoating.
For many years, we were concerned under the former Health and Social Care Select Committee about the defunding of public health, and we're spending less than 4% of the health service budget on public health. So it's being leached away.
Local directors of public health have long felt excluded, but there are worries major reorganisation during a pandemic will be distracting and disruptive. A spokesperson for the Department of Health and Social Care said, "We have always been clear that we must learn the right lessons from this crisis to ensure that we are in the strongest possible position, both as we continue to deal with COVID-19 and to respond to any future public health threat." The new institute will be in place by September, operational as the country braces for the prospect of a second spike this autumn. Laura Bundock, Sky News.